Dr. Jose Alejandro is the Director of Care Management at the University of California, Irvine Health, a Level 1 trauma and magnet designated academic medical center in Orange County, California. He is also a professor at Mount St. Mary's University in Los Angeles and visiting professor at the University of San Francisco. As Director of Care Management, Dr. Alejandro has oversight of case management, utilization management, clinical documentation, improvement program, clinical social work, and the Preferred Provider Network. As an educator, he has teaching responsibilities in the associate's, baccalaureate, master's, and doctoral programs. Jose began his nursing career as a licensed vocational nurse in the military. He has continued to advance his career and has earned a bachelor's, 2 masters, and a doctoral degree. He currently serves as a lieutenant colonel in the Army Reserves. 2 of his proudest moments include becoming a registered nurse and obtaining a PhD in human services. Jose is also a fellow in the American College of Healthcare Executives and the American Academy of Nursing. Jose has been a member of the Case Management Society of America since 2006. Over the last decade, he has taken on leadership roles in the Dallas-Fort Worth chapter of CMSA. He has served as chapter president and has served 5 terms on the CMSA National Board, including chapter president's council rep, 2 terms as treasurer, president-elect, and is currently starting his 2nd year as president. He was awarded CMSA's Case Manager of the Year in 2015, and in 2012, he received the Case Manager of the Year award from the DFW chapter. He has also served as the treasurer for the International Honor Society of Nursing Building Corporation of Sigma Theta Tau International and president for the Organization for Associate Degree Nursing Foundation. He is very active with the National Association of Hispanic Nurses and served as their 15th president from 2012 to 2014. Jose also continues to serve on the editorial boards of Professional Case Management, Nursing Economics, American Nurse Today, and MinorityNurse.com. These are just a few of the highlights from his volunteer portfolio. Over the years, he has consistently been involved in many healthcare organizations, both at the national and local levels. Jose's vision for his 2-year term is to strengthen the organization by increasing the visibility of both the national organization and local chapters, and increasing the number of ways we can collaborate with similarly missioned organizations. Our voice is stronger in numbers. Creating strength in numbers provides a stronger value add to our members. As CMSA's national president, Jose has been delivering his Future Vision of Case Management presentation at the chapter level. It is his hope that this message will help inspire case managers to become active change agents within a transforming healthcare delivery system. Jose also shares his passion specific to systems, thinking, and improving access to care for vulnerable and at-risk populations. Jose is the youngest of 13 children, raised in a bilingual family in a small oil industry community in South Texas. He was the first of his siblings to attend and graduate from college. He loves watching professional sports and traveling internationally. He enjoys spending time with and spoiling his 3 grandchildren. When asked why he became involved in case management, he simply said, "To make a large difference in the lives of others." He further notes that, as case management professionals, we have a unique opportunity to teach and mentor others in regard to the importance of healthcare across the continuum. The goal of each professional case manager is to ensure that care transitions support exceptional care to each individual and family we serve. Jose also shares his top 3 accomplishments in his career. These include becoming a fellow in the American Academy of Nursing for his contribution in case management, completing a successful presidential term for the National Association of Hispanic Nurses, and being elected to serve as CMSA's national president. Please welcome to the stage CMSA's national president, Dr. Jose Alejandro.
Thank you. Thank you. Thank you so much. I truly appreciate all of the energy and especially the number of first-time attendees that I saw this week. I wasn't going to tell the story, but since we're on an Ellen track this week from Las Vegas, I met Ellen probably in 2007. I was on the Dallas chapter board, and when I was there, I was selected or voluntold that I had to pick up a guest from Vegas. And so I picked her up, and I could not stop laughing all the way to where we were going. So as a result of that, I missed 2 exits. When I got to where we were going, I had to go to the restroom so bad that I thought I put the car in park, and I actually put it in neutral. And so thank God there was a tree there because it didn't go anywhere else. But it's been so much fun with the relationships that I've established over the years. As those that are here for the very first time, it's very important that you come outside of your comfort zone and introduce yourself to someone else. If you are more experienced, then please don't sit with people you know. Sit with people that you don't know. It's all about relationships when it comes to case management. I want to thank a few people that have assisted me because I am very involved with many organizations, and I have the support of family, friends, and actually colleagues. The University of California, Irvine Health is very supportive of everything that I have done since I arrived. I've been there about 14 months. 3 of the managers that report to me are here today. That includes Dr. Sonia Valdez, Sandy Stein, and then Sandra Schumann-Atkins. And there hasn't really been a week when I've actually been at work all 5 days, probably for about 4 or 5 months. But they've taken the big load of making sure that we continuously provide for our patient population throughout our organization. They're excellent at problem solving, but I think more importantly, they've provided support. To Charlie and to my siblings who have been extremely helpful during the past year. I have a 90-year-old dad that refuses to play by anybody's rules. And so he's been to the hospital several times, and unfortunately, the chief operating officer and the chief executive officer of this small town hospital I went to high school with, so I get all the calls. And so they tell me all the time, you have to case manage your dad. Well, I'm the youngest of 13, that's not gonna happen. So unfortunately, if you're ever in South Texas, make sure he's not on the road because he still tries to drive. And for the Texas Department of Public Health or Public Safety, shame on them for renewing his license every single year. To some of my closest friends that have been around me for a very long time, Christina Kelbaugh and her 2 kids are my godsons, and so Christian just completed his first semester of nursing school, so I'm super excited that I have someone following in my footsteps. I think the big thing for me is that it's all about family, friends, and family and friends can mean much more than just what happens from a bloodline. It could be people you meet in the military. Christina and I met at our first duty station, which was, for the Air Force folks in here, is no longer open, so I'm not going to tell you what year, because I think I actually was there when it closed, and that was Reese Air Force Base in Lubbock, Texas. Anybody here from Lubbock first? No? Okay, good. I usually call it Lubbock because it's right next to Bedrock, and so that's what, there is somebody here? Oh, I'm so sorry. I'm so sorry. So sorry. We'll take it out of the video. So I think it's important that you know that. And then through the CMSA organization, I've met so many wonderful people. The past presidents here have been awesome. They've been great role models, from Connie Commander to to Nancy Skinner, to Jeff Frater. All of these individuals, Ann Llewellyn, have helped shape who I am. And most importantly, not most importantly, but I want to recognize Peggy Leonard. And the reason I want to recognize Peggy Leonard is because I was I want to say this politically correct, I was gypped into running for CPC rep on the national board. At the time, I had no desire of serving any kind of boards. And so the very first assignment I got as a new member of the board, and this is like the very first day, I've never been to a board meeting, she looks at me and she's like, you got it, you've got to reformat the way the board's going to look, and you have 2 months to get it done. And I'm thinking, who is this lady? She's not one of my sisters, because I would have told her, you're not my mom. So, but again, great. They laid down the foundation of who I am today and the collaboration that has to happen. Then you have people that come into your life later in life. Later, I have Angie Millon, who many people confuse as my sister, but she's not. We actually just were in another association together. I have Ellen Fink Semnick, who I have a really good relationship with, and primarily through Facebook. And it's odd, but then we get together, and then it's like all those Facebook conversations have occurred throughout the year. And then you have other people come into your life that help support as you build your brand. And I tell everyone, every case manager, you have to build your brand. It's who you are, and it's what you stand by, and you have to be an advocate, and you have to be ethical in everything that you do. And I'll give you a couple of examples why I say that from my experience. Then you have other people that come into your life, and they come in and out, and then they eventually, sometimes they go away. One of the case managers that used to come here, her and I were stationed 3 times together, and her name was Iris Hash, and she was a case manager at Womack in Fort Bragg, North Carolina. We were stationed together twice. I was her supervisor once, and so I always tell the story of, she liked to go out and I liked to go out, so we went out. And so in the morning I get to the hospital. I was the officer in charge. I was the head nurse. And they say, Miss Hash has called in. I'm like, oh no. I know exactly where she was last night. Get her on the phone. And so I call her. I was like, oh no, you're coming to work. So then you have to do that. And then you have other people. I have other people have come into my life that have just provided so much more, and so I also want to recognize them. Kathy Fraser and I have a great relationship, and Kathy, by the way, Cheryl Akers won today, so that's 2 for Dallas and only 1 for Houston as far as awards, because I'm keeping track. And then, so as we go through life, we have to make sure that we are recognized as those individuals. And so the latest person that's come into my life is an individual called his name is Jesse Perez, but he brings a different kind of energy to the environment. And so sometimes it makes you think that you need to live life to the fullest. Now, the future of case management, I've been to several chapters, and let me tell you, Knoxville knocked it out of the park as a hospitality. Chicago did a great job. I went to Washington State, and I'm from Texas, so I thought it was Spokane, but I was corrected today by Google. It's Spokane. I don't see how it could be that because there's not a C-A-N in there, but it is what it is. So when it comes to case management, we really need to recognize that it's about building a culture within any organization, regardless of where you work. And so when I say that, oftentimes I see organizations, and I've worked for some of the big power organizations, such as Parkland in Dallas, Tampa General in Florida, and I've also worked for some of the big insurance companies. I didn't realize that Mary and I had a commonality, but I also started out at Prudential when I first started doing insurance case management, and eventually ended up at Aetna when we were bought out, and I met some additional folks here that are here. Organizations fail because they try and buy a culture. You can't buy a culture. You can't go get a box and say, this is how it's going to work. You have to learn who your people are. You have to know who your stakeholders are. But most importantly, you must know who your patients are. I often struggle with CFOs that say, I only want the paying customer. Well, at Parkland, I used to say, we're the county hospital. Where do you want them to go? At Tampa General, it was, we have the county mandate. Where do you want them to go? So I think you have to recognize that you cannot buy a culture, you have to build it. And it starts from the bottom, and it also starts from the top, and you have to work towards the middle. I think the other thing is that we have to remove ourselves from being very siloed. You know, I love when someone tells me, well, I'm an insurance case manager, I don't do that. Or I have an acute care hospital case manager that says, I don't want anything to do with the patient until they hit the door, and when they exit the door, I stop doing anything. And that's been very common throughout my travel this past year. And so I think we have to remove those barriers and start working with the different levels of the post-acute. You have to have relationships with your post-acutes, and you also have to have relationships with your insurance. Again, one's paying you and one's helping you discharge. And for our organization at UC Irvine, we are very limited in the amount of beds that we have every single day. So every chance that we get to partner with someone, we do that. And so it's about partnerships and relationships when it comes to that. The other thing I always talk to when I teach to CM leaders, and that could be a CM manager, a CM director, and I've even talked to some VPs, and I've gone out there and done assessments for some of the big organizations, is you have to train directors, managers, VPs, whatever level of organization within your organization, to know how to advocate for resources and also for patient tools. So my biggest thing is when I hear someone, even if it's a doc or a case manager, and someone tells me, this patient is non-compliant. There's no such thing as a non-compliant, because that tells me that you as an organization have given them all the tools to succeed. So they cannot be compliant until you've done that. And so I'm quickly to correct our residents, and I'm quickly to correct anyone else when it comes to that. But at the same time, I take the opportunity to learn from my staff. I also learn from my managers, and I also learn from you when I'm out traveling. And I've gotten so many great ideas for this next year when it comes to the programming that we'll do. The other thing is that we have to change is the way we look at when things fail. One of the mentalities I often see in organizations is, or the famous line that anytime I've ever interviewed with any organization is, our problems are because it's case management's fault. So, and I'm going to tell a story because my staff is here, but if they repeat it, there will be no raise on July 1st, I'm going to tell you right now. So I interviewed at UC Irvine when I came to Orange County, and so I interviewed with several people, and they said, you know, if we could just fix case management, you know, our discharge time would be a lot better. And I think we are usually about 2 p.m.-ish, and so they'd like to be at 10 a.m., and we know that the research shows that it's not possible usually, especially if you have residents and your attendings and things like that. So I said, I may have a doctorate, but I play dumb too, and I said, oh, I didn't realize that the case managers in California could write discharge orders. How long has that been in place? Oh, no. An attending has to write that discharge order. So when it comes to process improvement, you must change the mental models from it's case management's fault or it's case management's responsibility to how do we change the systems thinking of how we change process. So the very first thing I often tell individuals is when they're wanting to change something is where's the workflow? Where's the process map? Because if you don't have something that shows everyone at the table what you're trying to change, one change within your own department also affects all the others, and that's a cascade effect. Now, don't get me wrong, I love when I get the email from another director saying, effective this date, your team will be doing this. And I love the response, and I'm like, where's the collaboration? And I will CC their boss, because at that point, you're no longer staying within your sandbox. Now you're playing in someone else's because you felt that the change has to occur. Now, if they make a change without your knowledge and then it changes the whole process, we often tend to blame the individual, and that's where we do an injustice to an organization. The minute you put a name to a process that's broken, an individual's name, you've now made it personal and everyone will go on the defensive. The collaboration no longer exists, and so from a process improvement standpoint, we must work together so that we change the way we look at. And just as the video said, I feel like every case manager is a change agent, and it's up to us to change the way we practice and the way the care delivery is done. And so as we move forward this next year, we've identified some things that we'd like to do from a product standpoint, from an educational standpoint, and most importantly, from a networking and collaborative standpoint. And that includes partnering with other organizations because how many social workers are in here before I pick on you? Please raise your hand. Thank you for being here, first of all. I was trained by a social worker, so I want to make sure I put that out there before I say this. I don't understand why you guys have 5 national organizations, because it's more powerful to have one voice. So in case management, we have technically 3. We have the American Case Management Association, we have the Case Management Association, Case Management Society of America, and then we have CMSA that does the certification. But that's 3 with different aims and focus. But when I look at the social workers, there's 5. And so when I'm at work, and so I'll tell another story real quick. Before I got to California, in my previous 25 years of healthcare experience, I've been through 3 strikes. And those are not fun. Since I arrived in California, I think we're on our 4th or 5th, possibly our 6th this summer. But again, it's the collective voice and the partnership. So when we have that, every employee should be able to do what they need to, but at the same time, we must protect the patients during their journey. And so at UCI, we're a tertiary quaternary hospital, and so we have to have that bed turn because we get all the traumas in Orange County, and we get a lot of the burn patients and then also the neuro catastrophic patients. So in closing, I just want to say a couple of things. One, I was so glad that Kathy Fraser didn't pick on me, because I gave her every opportunity to this morning at the business meeting. And number 2, is there any physical therapists in the room? I'm still sweating from the yoga this morning, and I can't stop. And unfortunately, there were so many people there. Oh, don't go anywhere. And so there were so many people there that we're going to do this again. And if you take one picture of me again, I'm just going to walk out because I don't know what I'm doing in there. And they're saying all these words, and I'm starting to think that it's Star Wars or something, or that my translator's not working. But they're going to do yoga again at 6:30 on Thursday in the St. Croix room. And so make sure that you're there early, and do not take the last spot on the last line, because that's mine. There is no way I'm going to sit and be anywhere in front of anybody else. And then lastly, if you're a first-time attendee, I want you to raise your hand. Look around. Just as I asked in the annual business meeting, you must get 5 cards today of people that you don't know, and then you must sit with someone so that you get to know someone. It is very lonely to come to a conference when you come with no one else. But I tell you, once you meet someone, those relationships last forever. Thank you so much.